Good afternoon, everyone. I'm County Administrator Phil Church, filling in for Legislature Chairman Jim Weatherup in this week's COVID update. Today is March 2nd. Yesterday, our health department announced revisions to its policy for indoor school and youth recreation events involving higher risk athletic activities. We are still required to comply with New York State guidelines, but starting tomorrow, March 3rd, schools and youth leagues will be allowed to admit spectators at indoor home games. They may admit up to 50% capacity of their spectator area, or 2 spectators per athlete, whichever number is smaller. The revised policy also allows athletes to travel to sporting events in other Section 3 counties. The county policy was changed to reflect the decline in new COVID cases over the past month. It may be revised again if COVID-19 cases increase or if new variants are found in Oswego County. Other provisions of Oswego County's policy on higher risk recreational and K-12 school sports remain in effect. The guidelines are posted on the Health Department's webpage at health.oswegocounty.com. Our health department works closely with area school districts to monitor and adapt to changes in the virus activity. As we've mentioned previously, our public health director, Zhenxing Huan, is a trained epidemiologist. He and his team have tracked COVID-19 virus activity in the county for the past year. We're making progress. The State Department of Health reports that 16.5% of Oswego County residents have received at least one dose of COVID vaccine. The state average is 15.2. 19,413 of our residents have received at least one dose, and 10,647 have completed both their first and second doses. This is truly a community effort. It would not be possible without the important work of our healthcare partners who are providing vaccination clinics and volunteers who support these efforts. However, we are still seeing a higher rate of new infections than we would like to see in Oswego County. This means that the virus is still active in the community, and that we haven't achieved the level of immunity that we would like to see at this point. We still need to do our part to prevent the spread of the virus. Over the past week, the federal government announced changes to the Paycheck Protection Program to help small and minority-owned businesses. Between now and March 9th, only businesses with fewer than 20 employees may apply for Paycheck Protection Program loans. This provision allows lenders to focus on serving small businesses such as sole proprietors, independent contractors, and self-employed individuals. If you are a small business affected by this COVID pandemic, I encourage you to visit the SBA.gov website for more information. New York State's rural counties are starting to receive more shipments of vaccine, and our county health department is now able to offer vaccine to more people who meet the state's criteria. Diane Oldenburg will share the latest data and more information about the health department's vaccination clinics.
Thank you, Phil. Our 7-day positivity rate continues to decline. Today it's at 1%, the lowest in 4 months. The last time we were at this level was November 1st. As of this afternoon, we have a total active positive case number of 123. Total tests received to the health department is 153,087. Total cumulative positive cases, 6,340. Total negative results, 144,604. Total patients released from isolation, 6,128. Deaths reported by the New York State Department of Health related to COVID-19, 89. And currently, there are 319 residents in mandatory quarantine or isolation. The county health department has vaccinated 5,677 individuals. This includes 3,669 people who received their first dose through the health department clinics in 2008 who received both their first and second dose through the County Health Department clinics. We are now receiving more vaccine and able to offer more clinics for people with underlying health conditions. Beginning at 10 a.m. Thursday, March 4th, our department will post links to vaccine clinic appointments on our website at health.oswegocounty.com. We are also setting up a vaccine hotline, which will be open from 10 a.m. to noon on Thursdays. The number to call is 315-349-3383. Appointments are expected to fill quickly, but we expect more appointments to become available as time goes on. Please be patient and check back often. You can find more information about the state eligibility criteria and links to our website at health.oswegocounty.com. Anyone who attends a health department vaccination clinic must have an appointment and bring proof of eligibility. Those without an appointment or proof of eligibility will not be vaccinated. Our vaccine clinics are a community effort, and we can always use more volunteers to help with registering and screening people, traffic flow, monitoring, and other tasks. A medical background is not required. To sign up, please visit the health department's coronavirus page and click on the link for medical volunteering. Thanks.
Thank you, Diane. I want to remind everyone that the Office for the Aging is offering boxes of canned goods to seniors who need help making ends meet. There is a limit of 1 box per household. To make arrangements to receive a box, please call the County Office for the Aging at 315-349-3484. Thank you for doing your part to prevent the spread of COVID-19 in Oswego County. In closing, on a more personal note, on behalf of all county government, I would like to express our condolences to Legislature Chairman Jim Weatherup and his family on the loss of his father, Thomas Weatherup. Mr. Weatherup was a life resident of Central Square who left a lasting impact on our county. He was a local businessman who also worked to improve his community. He donated land for a health clinic and ambulance services for the North Shore area. He also served as town supervisor and in many other capacities on various boards. He was a veteran of the U.S. Navy Seabees. He improved the quality of life in Oswego County through his vision and generosity. Thank you for watching, and have a safe week.